Question: if you have two clients come in, same disc bulge, 405 on their MRI findings, should you treat them the exact same way? Well, absolutely not, because one of them may have pain, the other may not have pain. Why does that even happen? Never treat based on only the MRI. When it comes to spinal mechanics, it's not about diagnosing as a massage therapist. That's outside of our scope. However, our job is to identify red flags, assess the client, see what's overworked, see what's underutilized. That way we can find the best and safest treatment option. Did you know the majority of spinal injuries don't happen on just one incident? Most occur one of three mechanisms. One is repetitive stress. Sitting at a desk 8 hours a day, every day. Bending, poor posture. You have years of loading these same tissues over and over and over again. It can increase the chance of an injury happening. On top of that, eventually your body starts adapting to what you do to it. The number two would be acute trauma. That's when you have like a fall, accident, something like that. Maybe even heavy lifting. Force extends past what the tissues can tolerate. And then number three, of course, you got your age-related. As you get older, so does your body. Discs lose the fluidity, joint surfaces wear, bone spurs can develop. However, none of these automatically say that client is going to have pain. The spine has different discs inside. These count as little shock absorbers. Now, each disc has an outer ring called the annulus fibrosa. It has a softer gel center, nucleus pulposus or whatever. Now, a disc bulge happens, or a disc starts to push out, but the outer fibers of that disc stay intact. Think of squeezing a water balloon. A herniated disc is when that disc can actually, if you see in this guy, the red marker here, material pushes outward farther than the outer ring. And sometimes, not all the time, does that irritate nerves. Many people have bulging disc, and they don't even know it. Not every time if you have a bulging disc or a herniated disc, does it mean you're going to have pain. So this is a really big mistake that a lot of massage therapists make. Client comes in, they say they have a bulging disc. Then the massage therapist assumes that that bulging disc is causing everything. Imaging does not always tell the full story. You know, research actually shows that people can have significant degeneration, and they'll have arthritis, and they'll have maybe even some disc herniations, but they have no pain. Then at the same time, you can have somebody who has mostly the opposite, where they don't have near these symptoms, their disc isn't coming out as much, or but they're in an intense amount of pain. Pain is influenced by much more than just the structure. We're going to go over nervous system. What affects pain? Stress, sleep, movement, previous injuries, fear of movement. Then you got overall tissue sensitivity. What about a client they're sensitive to everything as far as by touch? You have some that are more sensitive than others. As massage therapists, we evaluate the person, not the MRI. The MRI is a tool, but it's not the sum-all. Then you'll have a lot of clients, who come in. They'll have degenerative disc disease. That is a terrifying word. However, it's usually just a normal thing that happens in the body. A lot of age-related changes. Then you have facet joint irritation. Remember, the facet joints are the joints on the outside of the spine, and they help control movement. And often, when they're irritated, they produce local pain. Then you got spinal stenosis, and that is the narrowing around the nerves. So the nerves are getting squeezed. Many clients are actually going to feel better when they're in a flexion state, because that flexion temporarily creates space around those irritated structures. You got sciatica, remember? Sciatica is not an actual diagnosis. It's a symptom pattern. Pain, burning, numbness, tingling. Traveling down the leg. The important question is, what is irritating that nervous system? Now, remember, massage therapists, we do not put discs back together. We don't reverse arthritis. We don't fix spinal stenosis. We don't realign vertebrae. But what we can do, reduce protective guarding of the muscles, calm the nervous system, improve comfort and improve pain tolerance, and improve movement tolerance, teaching safety to the body. We address compensation patterns, and that's an entirely different goal, and a much more realistic goal. Now, as a massage therapist, you're always going to want to know when you need to refer out. it's okay. You can refer out. If someone starts to develop loss of bladder control, obviously, I think that's an obvious. Send them somewhere. If their symptoms are just progressively getting worse and worse, or if their symptoms are getting worse by weakening symptoms. If they lose sensation in their groin, they have just sudden severe night pain or significant trauma to the body. Those are referral situations. So remember, treat the client, not the MRI. Use the MRI as a tool, but that's just a tool. Two people can have the same symptoms, two different results. So use it as a tool, but don't use it as a sum-all. Pay attention to assessing the client. See how they're standing, see how they're sitting, see if they're leaning or favoring or have overactive muscles or underactive muscles, stuff like that. Find those answers and you'll find ways to help them. Thanks for watching. Please hit subscribe and share with your friends.